So happy morning, everyone, and happy morning, Ravi. So here,
Thank you. Happy morning.
so Ravi, Dr. Ravi is my MBBS batchmate, and we have worked together in rural postings. So very nice human being, and here he is the nephrologist. So who has done DNB in nephro at St. John's Institute of Medical Sciences, Bangalore. So we are here to podcast kidney health today. So we heartily welcome Ravi here. Hi, Ravi.
Hi, Girija. Thank you very much for calling me for this program.
I'm really very happy to meet you like this. So
Sure.
if not offline, at least we are meeting like this. That's a
Online. Yeah,
great thing. Or
correct.
online. So meeting the
Correct.
friends or batchmates is such a happy thing. So one is happening with you with the first start. That's great. So let us start about the kidney health. So can you just tell me like why kidney is called the how we can make it a best friend?
Exactly. Yeah, thank you, Girija, for having me here. So, with this kind of discussion with you, I think we should reach more and more people, especially the general public, about kidney and why is kidney so helpful and it's always the best friend for us. Okay. So, when do you call a friend as a best friend? So a best friend can be always not an exactly a person, but a best friend can be a thing which is already there in your body, and you need to discover and know more about it. Why I have started telling that kidney is your best friend because there is always someone in your life and someone in your family who is always want to do good thing for you, especially when you are in bad times. So similarly, kidney is always your best friend. He may not make much sound because a heart always keeps pumping blood and making sound for you. Okay, you can hear a beating heart, but you can never hear a beating or a working kidney. So it's a very silent functioning organ in the body. And as I said, it is working uh, around the clock, even when you're sleeping, when you're walking, when you're talking. Now we are discussing with each other, and all the time, kidney is receiving blood. It is doing its work. It is trying to filter all the impurities in your body. Okay, so that is why a kidney is always a silent and always functioning 24 by 7 for your well-being. Okay, so why it is a good friend for us because see now every day you consume some amount of water. Okay, you say 1 liter of water or 2 liter of water, and you always have a question in your mind. What is the thing in the body which helps us keep the required specific amount of water which is required for us? Okay, and during summer, you need
More
you
water.
sweat. Yeah, you sweat more and your urine excretion is less. And in non-summer days, it could be a winter or a rainy season where water is not that much essential, and most of the thing what you consume is excreted in the form of urine. And kidney is the organ which uh, senses how much is required for your body. And in when your climate is humid and you are working too much, you are doing exercises, that time kidneys will try to conserve the water. It will keep the water for your body and excrete only what amount excess amount of water which is required for your um, this thing body, and it is excreted in the form of urine. So it mainly helps the water balance. Okay, so that will help the body keep hydrated well. Okay, and that is why most important function of the kidneys. And the second most important function of the kidney is maintaining the salt level in your body, what is called as electrolytes, the sodium, the potassium, and to many other salts which are in our body are balanced by the kidneys. Okay, so when you take more salt, the kidney pumps out the extra salt in
Extra
the body.
salt.
Yeah, correct. So when your salt intake is very poor, that time kidney will try to conserve the salt content in your food. So it is so when your salt and water is well controlled, your blood pressure becomes well controlled. See, these two things are very important for you. When your salt and water is becomes uncontrolled, you'll get swelling in the legs. Your blood pressure will increase. Or if the salt is very less, water is very less, your blood pressure may go down. So that is the reason BP is well controlled because your kidney is functioning round the clock, and that is the reason it is called as the best friend. And when you have so much of things to do, walk around, when you want to sit, stand, run, so at that time your hemoglobin has to be very well. Okay, so there is a hormone which is produced in the kidney that is called as erythropoietin. Okay, this erythropoietin is the hormone which is produced in the kidneys, which helps in maintaining your hemoglobin levels. So when you are anemic, when somebody says your hemoglobin is low, so kidney is also one organ which could be in trouble where your hemoglobin can go down. That is the reason, one more reason that why your kidney is so friendly for you. And one more thing is you might have seen many people coming to you with fractures. And to maintain a very good vitamin D levels in your body, there is what is called as calcitriol. It's calcitriol, which is very important for your active form of vitamin D, which is mainly synthesized in the kidneys. So that helps in maintaining your bone health. And so all these points what I mentioned is beyond doubt, where it says that kidney is very friendly and it takes care of your health. And as I said, so
But
when you want to have a healthy family in your life, it is not that only the father has to be healthy or the mother has to be healthy. It has to be the health of the whole family.
whole
So
family.
yeah, correct. Similarly, our body is like a whole family. You should have a good eyes, you should have a good heart, you should have a good functioning brain, all the vessels, everything. So to maintain everything, kidney is very important. Okay. So that is the reason it is a very friendly organ, and you have to take care of your kidney. Should know more about your kidneys with all these kinds of educational activities.
Information. So
Info.
that's wonderful information. We always keep thinking that kidney is like just to pass the urine or like whatever extra water we take, it's going to balance ani. So just let me convert a little bit into Telugu part so that viewers here can understand. So ఈ కిడ్నీ అనేది మనం బెస్ట్ ఫ్రెండ్ గా ఎలా మార్చుకోగలము అని అంటే ఒకటి మనం కిడ్నీ ఫంక్షన్ గన తెలుసుకున్నామంటే ఇప్పుడు మనకు డాక్టర్ గారు ఏం చెప్తున్నారంటే ఒకటి అంటే ఇప్పుడు గుండె అనుకోండి శబ్దం చేస్తూ మనకు చెప్తుంది ఇలా ఏదో ఫంక్షన్ చేస్తున్నానని చెప్తుంది. ఆయాసం వస్తే మనకు రెస్పిరేషన్స్ అంటే లంగ్స్ పని చేస్తున్నాయని. కానీ కిడ్నీ పాపం సైలెంట్ గా అది తన పని తను చేసుకుంటుంది కాబట్టి దాన్ని ఎవరు పట్టించుకోరు అనమాట. కానీ అది ఎంత పని చేస్తుందో అనేది మనకు డాక్టర్ రవి గారు చెప్పడం జరిగింది. సో డాక్టర్ రవి ఈజ్ వర్కింగ్ అట్ సాయాద్రి నారాయణ హాస్పిటల్ షిమొగ్గాలో, కర్ణాటక. So you can contact him there. So ఈ కాంటాక్ట్ డీటెయిల్స్ కూడా మనం ప్రొవైడ్ చేయడం జరుగుతుంది. హాస్పిటల్ డీటెయిల్స్ యూ కెన్ ఆల్వేస్ కాంటాక్ట్ హిమ్. సో మనకు రవి గారు ఎంత చక్కగా చెప్పారు అంటే కిడ్నీ సైలెంట్ గా తన పని తను చేసుకుంటుంది. ఒకటి వాటర్ ని అదే బ్యాలెన్స్ చేసేది. ఎండలు వచ్చినా కూడా, ఎండ వచ్చిన వర్షాల టైంలో దాన్ని చూసి అది వాటర్ ని బ్యాలెన్స్ చేస్తుంది. సాల్ట్ ఎక్స్క్రీషన్ అంటే సాల్ట్ ఎక్స్క్రీషన్ ఎప్పుడైతే బీపీ మనకి ఎక్కువగా ఉందంటే సాల్ట్ లోపల ఎక్కువగా ఉందని, సో కిడ్నీ ఎప్పుడైతే మంచిగా ఫంక్షనింగ్ అవుతుందో సాల్ట్ ని తీసేసేయడం జరుగుతుంది. అండ్ హెచ్పి మనం హిమోగ్లోబిన్ ని పర్ఫామ్ చేయాలన్నా మనకు కిడ్నీ కావాలి, వైటమిన్ డి కూడా మనకు కిడ్నీ కావాలి. సో ఈ 4 చక్కగా పెట్టుకోవాలని రవి చెప్తూ ఉన్నారు. అవునా రవి?
కరెక్ట్ గిరిజ. నా
ఎస్.
తెలుగు చాలా బేసిక్ గా ఉంది. సో ఎక్కువ మన తెలుగులో మాట్లాడేది కష్టం అవుతుంది.
సో దిస్
థ్యాంక్
ఇది
యూ.
కూడా బాగుంది రవి. దట్స్ నైస్. సో లెట్స్ గో టు నెక్స్ట్ థింగ్. అంటే ఇప్పుడు ఫర్ ఎగ్జాంపుల్ సమ్ పీపుల్ విల్ స్టార్ట్ టెలింగ్ లైక్ దే ఫీల్ యాంగ్షియస్ సూనర్ దే గెట్ డయాగ్నోస్డ్ విత్ ఎనీ ఆఫ్ ద కిడ్నీ ఇష్యూస్. అంటే స్పెషలీ రొటీన్ గా చేసుకొని ఉంటారు వాళ్ళు. ఆర్ఎఫ్టి అంటే క్రియాటినిన్, యూరియా రొటీన్ బాడీ చెకప్ లో చేసుకొని ఉంటారు. అండ్ దే సడన్లీ ఫైండ్ ఇట్ వెరీ హై ఆఫ్ రీనల్ పారామీటర్స్ or something like that. So do that person has to get scared looking at this investigations.
Yeah. So whatever the reports which you get done, okay. So as you said, it could be your serum creatinine levels or your urea levels. But suddenly you get it done for some investigation purpose, and you see that your renal functions are little bit elevated. Similarly, you can have a urine test done. Okay. So if you know urine test done, it could have some albumin leak in the urine, or it could be some blood leak in the urine. So all these kinds of investigation will tell you you have some kind of kidney disease. And as I want to tell you all people, viewers here, is that if somebody says you have a kidney problem, it is always a, a thing where you have to keep. That means that you are not able to maintain a good balance in your body. It could be in your food, it could be in your exercises, or it could be the habits which you do. So which will help in monitoring your health. So whenever you say that somebody says that your creatinine is elevated, your urine is having some protein leak, so don't get too much of worried. So it's always there is a time to improve yourself. Okay. So whenever somebody says your creatinine is elevated, try to look into the reason why it is elevated. Okay. It could be a temporary reason also. Somebody's see sometimes you get a gastroenteritis and your body get dehydrated. Okay. When you don't have enough water in the body, or it could have taken some painkillers. Okay. Sometimes it's very common. You work for the whole day and in the evening you have some pain and you take a diclofenac or an nimesulide or some an injection of painkiller. All this, there are some reasons where your kidney can be in trouble because of your it could be an unwanted tablet, or it could be an uncontrolled diabetes or hypertension which is causing the elevation in the creatinine. So whenever you have an abnormal kidney function, don't panic. That is the most important thing. If you keep panicking, you don't know what to do. So you keep your mind calm and try to know the reason why your creatinine is elevated. Okay, and as the statistics says, in India, the most common reason why your kidneys have problem is because of uncontrolled diabetes and uncontrolled hypertension. That is the reason for 60% of the kidney problems in India. So whenever somebody says your creatinine is elevated, try to look into the cause of it rather than getting panic. So if you have a hypertension, try to control your hypertension. If you have a diabetes, try to control your diabetes. And don't go for self-medication. That is what I want to stress out here. And you see something on the internet, or you hear somebody, your good friend, saying these medications work well for your kidney disease. Don't go by that. Okay. And there are always specialists who have learned their whole life uh, in discussing and would have thought more about the kidneys, and go to a specialist rather than taking self-medications. And that is the message I want to give all of you. Whenever you have a kidney problem, first thing is you should never panic. You should never panic, and go to a specialist or go to a good friend of you, a good doctor, and ask him and try to investigate why your creatinine is elevated, and should always discuss with your doctor what is the best thing to get rid of your problems. Okay. So never panic, but always take a proper advice and don't go for self-medication. That is very important for you.